Today our guest is Dr. Prakash Rao B. MD, PhD. We know that this is our 1298th day of Zoom meeting. Started 1298 days we passed. We are approaching a wonderful day. So I invite all from different parts of the world to share our platform. And we know that Dr. Prakash Rao, a great scientist, a homeopathic science philosopher, a great personality. He had done many classes in our platform with wonderful evidence-based literature and everything. His practice and cure history. Now holding a postgraduate diploma in physical medicine and rehabilitation. Undertook project with UNICEF and AIDS Control Society. And the winner of many awards for the outstanding work for homeopathy. More than 30 years of experience at Central Council of Homeopathy. Today, his subject is what is cure and curative part. Is he joined? Doctor, please raise your hand if you join.
Oh, sir. Good evening, sir. Can you hear me, sir?
Yeah, we can hear.
Sir, you have to
but we
unmute
cannot
me.
see you. But we cannot see you.
Yes, sir. You have to unmute me. You have to give me permission.
Okay. I shall make you co-host, yes. Okay, sir. I made you co-host. Sir?
Sir, now, can you see my slides?
Yeah.
Both visible to
Okay.
participant and screen.
It is visible, sir. It is.
Now visible. Okay, sir.
Okay. We are in the solar system, isn't it?
Now, can you see the slides, sir?
Yeah.
Yes, sir. Now, good evening, Dr. Hubert De Silva. Everybody.
Good evening, sir.
Good evening, sir. Now, my part of this is the third part of what is cure, what is curative. Now, this looks as if a small word, but this is behind these small words, there is total homeopathic philosophy and the allopathic recent advanced medical technology that is present. According to homeopaths, see, when homeopathy developed, the allopathy was very backward system in 18th century, 19th century. And when allopathy started developing, homeopathy became a totally now a system that is called, I am sorry, we have to accept that they always criticize as homeopathy because it is a unscientific methodology, because the science and technology are the subjects which will grow day by day, and the technology has to go hand in hand. Otherwise, what happens? The healthcare system belongs to the total human development. So, healthcare masters are healthcare dependents, and healthcare technology makers is not only the property of allopathic system of medicine. There are various systems of medicines where combined together, the diseases can be controlled. It is not so easy to control all the diseases that are present because the scientific knowledge has maximum developed. The developed scientific knowledge doesn't mean that it removes all the diseases, and it also removes the death. See, birth and death, they are the very commonest. One is natural health, one is natural phenomena. So they cannot be, they may be postponed, but they cannot be removed. So one medical system feeling too much advanced and one medical system thinking that it is backwards, it never goes. Both the system are complementary to each other. This only comes whenever we think of prosperity of the people of the total world. So this all is being covered by cure and curative. Cure is disappearance. What homeopathy thinks is cure is disappearance of signs and symptoms and making the life force, that is again vital force, the theory, the life, the spirituality, the why that spiritual system, the implementation, or the considering the life and considering the disease as mental, spiritual, and physical, or spiritual, mental, and physical. So, keeping the life force, functions of all sensations and functions in a harmonious way. See, when we ask our hand, fingers to fold, it has to fold. Whenever we blink our eyelids, the eyelids will be closed. Whenever there are sympathetic actions, the sympathetic actions will take place. This is known as harmonious functioning. So, this harmonious function is known as cure. This is mentioned in first aphorism. The physician's highest, high and only mission is to restore the sick, to cure, to health, as it is termed. Again in aphorism number 5, 6, 7, 8, 9, the vital force, the total curative aspect, what is cure? It has been discussed in detail in philosophy. Cure is permanently removal of the suffering. Homeopathy believes permanently removal of the sufferings in healthy human beings and bringing the former state of the health, again making a human being to feel normally. But the modern definition is removal of signs and symptoms for more than 3 years is known as cure. Suppose if we go to a modern practitioner, they treat every human being who is suffering from a disease. So when they are treating, they consider the disappearance of symptoms, or the WHO definition of cure is disappearance of symptoms and signs for more than 3 years. Suppose if they are treating a malignant patient, if the malignant patient is free from the signs and symptoms and sufferings and development, the period in between first effect of the malignancy and the development of the secondary symptoms after 5 years or 10 years, these 10 years period is known as cure according to WHO. But whereas homeopathy believes that a disease has to disappear from the body till the human being exists or lives. So there is a lot of difference of understanding a patient for a definition of small cure among the allopathic doctors, among the homeopathic doctors, among the homeopathic physicians and allopathic technologists is entirely different, because they think that some of the disease conditions will reoccur. But homeopathy thinks that the holistic approach is more important. A patient has to be treated simultaneously from all disease and he has to restore his normal health. So in homeopathy, it will be deemed like cure is a permanent state of mental and physical and spiritual health. So what is the word cure comes from Latin cura, which means care, concern and attention. The care and concern and attention is spiritually possible. The care, concern, attention during the period of treatment is known as allopathic cure. The care, concern and attention in the total life period of a patient is known as homeopathic cure. A cure is a treatment that eliminates the disease or illness, such as bacterial infection, treated with antibiotics. This is allopathic way of explaining cure. It can also refer the state of being healed or restored a good health condition. See, treating one case and suppressing of the one case. See, in homeopathy, we use after cure, there is treatment. Even in allopathy, there is treatment, there is suppression, there is palliation. But they never take into the human being into so detailed. That's why that is not a holistic system of medicine. Whereas homeopathy thinks in a holistic approach, so they think cure is different, treatment is different, suppression is different, palliation is different, giving treatment is different, and making the patient free from the symptoms is different. Whereas in allopathy, the treatment part, management part, making the patient free from symptoms and making the patient less suffering is known as cure. Though the science has developed, the approach toward the patient has not developed. Here the science developed in homeopathy when allopathy was totally backward. The homeopathy system originated because the allopathic system was not in a position to manage total healthy human beings, and the homeopathic system was developed again is the attitude of the allopathic doctors and the attitude of the allopathic science, which was underdeveloped in those days. That's why you will find in our philosophy lectures the orthodox system of medicine. Orthodox means backward, orthodoxically following way, giving harmful treatment. In those days, the homeopathy was developed only against the allopathic system of medicine, which was deemed as scientific system of medicine. But after the invention of Edward Jenner virology theory and Koch's disorders, tuberculosis, the homeopathy system was not in a position to go forward because there was a homeopathy allopathy conflict as well as something in the way of think tank happened. So homeopathy is facing such a difficult situation these days. Now, a cure is different from recovery. Recovery means disappearance of signs and symptoms for more than 3 years, which means getting better and not abusing substances. Most disease conditions are not curable. See, the diseases also, such diseases are present on earth that are affecting the human beings. Most of those disorders are incurable. Suppose everything is genetically modified, everything is chromosomal defectiveness. So, such these disorders, even Hahnemann understood better than the allopathic doctors under the chronic diseases. So, a cure is when a treatment makes a health problem go away and is not expected to come back. See, this is the difference. This word is small, not expected to come back. Word is very small, but understanding and the technology is very difficult. See, allopathic doctors never expect that, expecting not to come back. See, for them, the disease, if it comes after 3 years, they say that these are the secondaries, and he was very happy for 3 years. He was symptomless for 3 years. He was asymptomatic for 3 years. But in homeopathy, it is not like that. Some health problems have a cure. For example, to treat athlete's foot, see, spercalcanium, bursitis, fevers, healthcare provider use special cream, something, we will give some medicine, it is totally curable. But whereas hemophilia, it can be suppressed, it can be palliated. So in the same way, the expected to come back to normal stage for a allopathic doctor is different. For a homeopathic doctor, it is an achievement, it is an holistic approach. He believes in cure, not believes in giving alone treatment. And what is the cure and what is curative? In the sense, we will talk about chronic diseases. In chronic diseases, why I am talking about chronic diseases means the Hahnemann understood what is curative, what is cure, what is curable. So curative means a drug substance that will become a medicine. Cure has to be brought means it needs medicine. And what is curable also he understood very thoroughly. He divided the diseases into chronic diseases, which you all know. Just I am making you to refresh again with the disease so you can critically think. Disease with fully developed symptoms. Again, the disease with fully developed symptom is divided into non-miasmatic and miasmatic. The non-miasmatic disorders are from hygiene, from drugs, iatrogenic causes. Iatrogenic causes you will find more in allopathy, less in homeopathy. Despite of that, the homeopathic aggravation, he entered into the science so much. In those days, whatever tool that is available scientifically analyze the diseases, Hahnemann has did maximum work. And in modern science, we can do that work very easily with available technology. So from hygiene, lack of hygiene, not bathing, environmental pollutions. Now ozone layer is coming down. In Delhi, there will be pollution. And from hygiene, from drugs, iatrogenic causes. If one consumes the allopathic medicines, the side effect of the medicines, the side effects of the antihypertensives, side effects of diabetic medicines, side effects of painkillers, these all come under iatrogenic causes and occupational disorders. One who works in industries, one who works in some of the chemical companies, they will develop such a disease, chronic cough, who work in asbestos, COPDs, who work in chemical company. Usually, I got a case of a research scholar who used to work with nitrous oxide and who will work always with chemicals such as anacardium. These are the botanical chemicals. They are working in drug company. So the side effects of the chemical preservatives, they all come under occupational disorders. The other thing is multi-miasmatic disorders and single miasmatic disorders. You know very well about multi-miasmatic disorders, that is psora syphilis, syphilis psychosis, psychosis psora syphilis, syphilis and psychosis, and psora and psychosis. So why this psychosis psora I am talking about is, in those days, the technology of identifying the virus, technology of identifying bacteria, technology of identifying immunology was not present. Nowadays, they have developed. So when the technology was not present, but the depth of the disease conditions was very well understood by Hahnemann. So he found out there is some noxious agent present. It is causing the double complex diseases as well as single complex disorders, that is known as miasmatic disorders. These miasmatic disorders, see, diseases with few symptoms. They are one-sided disease, he called. They all are psychiatric disorders such as schizophrenia, autism. See, by birth the disease will come. And one-sided depressive psychosis, puberty psychosis, after delivery, the postpartum psychosis, and local diseases such as surgical. What are the local diseases in double complex diseases? Imperforation of the anus, 6 fingers, chromosomes, abnormalities, cleft palate, they all need surgery. So here, what is cure, what is curative means, a homeopathic doctor must know, can he cure the imperforation of the anus by birth? No, a hole has to be made. For that, the surgery is required, and we have to send the case to a surgeon. And there will be 6 fingers. If one finger has to be removed, then he has to send the case to a surgeon. Cleft palate is a chromosomal disorder for which the upper lip will be given sutures, and plastic surgery is needed to avoid the cross sectionals, and sutures material are the abrasion because of the sutures, and the hair follicles must be present and they have to be produced, for which the surgeon's role will be more than absolutely no medicine. So this, up to this extent, Hahnemann understood what is cure, what is curative, how it will be. These all comes under a organon of medicine, from 71 aphorism to 102 aphorism. So thoroughly he discussed that we have to apply only modern knowledge to his classification of the diseases. Then 5 diseases. Now we have to see that what are the disease conditions that are curable with allopathic medicines. Why I am telling these means, these are the diseases according to WHO. They have found out total cure with modern system of medicines. We are finding out total cure with traditional, that means with homeopathy, that was developed in 19th century and that is still among the people, giving the maximum potentiality of the treatment, curing all the left out cases of allopathy, and taking one of the incurable case and curing that case. For that, we have to apply this modern knowledge so that we will cure various disease conditions on par with allopathic doctors. So what are the 5 disease conditions are? They are the affecting world too much. One is tuberculosis. In 60s, See, where the scientific disaster will be present, just I will tell you one of the examples of tuberculosis. Now the antibacterial drugs have been developed, that is antibacterial medicines. Tuberculosis is one of the 1960, 1955 to 1970. It was a horrible disease condition used to kill most of the people. See, now it is totally curable with allopathic medicines. Now in previous days, when homeopathy has started, in homeopathy, one classification is tubercular miasm, and one fantastic study has been done by Dr. Kent. A tuberculosis patient, if tuberculosis is treated, the same immunosuppressions will take place in some of the cases, and he develops schizophrenia. So out of 100 tuberculosis cases that have been treated in the world so far, one patient will go for schizophrenia, and the mental disorders he treated with the tuberculinum. And he has gone to over enthusiasm. He started giving tuberculinum, CM, and higher potencies to prevent the tuberculum in intrauterine life. So his thought process was extremely very well. He don't have any gadgets. But in modern theory, a tuberculosis patient, out of 100 treated tuberculosis patients, one will go for schizophrenia. You will find the same thing under the medicine tuberculum in Kent, America. So now that disease is curable totally with allopathic drug. And HIV, 1980s and 90s. HIV was a dreadful disease. It was a contaminated disease. So these diseases are thoroughly studied by Hahnemann under syphilis and psychosis. And he developed anti-miasmatic medicines such as mercurius and medorinum, and many antipsychotic medicines which were useful for treating the physical contamination of the miasm. He don't know what is noxious agent. He hasn't seen AIDS virus. He hasn't seen tubercular bacteria. But both the theories he discussed and he understood. Then malaria. The homeopathy origin itself is because of cinchona bark. If there is no cinchona bark, there is no evolution of homeopathy. So cinchona bark, quinine, and malaria. Now malaria is being treated with quinine in allopathic system of medicine. Why the egg fever came in a patient and why that egg fever has been treated in that particular patient. This is the experiment, that is quinine China bark was tested by Hahnemann. He has written and he has rewritten the word egg. See, because it is producing egg fever, it can cure the egg fever. So cholera, see, the Vibrio cholera is the, why he named the morbific agent or psychosis or sora or syphilis, because in those days he know that cholera is not merely by some of the diseases where allopathy never understood. They were blank about cholera, and it is the in the footnote you will find that cholera is because of a morbific agent or noxious agent which he assumed, and he has written. And in West Bengal, Dr. Mozamdar has been given award in those days, and under his name, in the history of India, there is around 10 pages of Dr. Mozamdar's life history, how he controlled cholera in West Bengal in 1936 and 37. Most of the homeopathic doctors will not come under reviews of history books, but Dr. Mozamdar has come under the history books as a person who controlled cholera in West Bengal. These are the 5 diseases. Now they are completely treated and completely curable with allopathic medicine. These are the 5 diseases where the Hahnemann has planned, and out of that one disease that is malaria, which we had homeopathy to evaluate in today. Now, top deadliest diseases that are present in the world. Now, this is all previous history. What is cured? What is curable? Now, these are the disease conditions which are killing all the human being despite of the various technologies that are available at present in the world. What are these 10 diseases are? Ischemic heart disease or coronary artery disorders. By that, ischemic heart disease leads to stroke, stroke to lower respiratory infections such as bronchopneumonia, pneumonia. Any condition, if you happen to see in intensive care unit, all the patients from any quarter of the, whether he is a diabetic patient, whether he is a hypertensive patient, whether he is a post-surgical patient, whether he is from corona or whether he is from bronchitis or malignancy, he will die at last if there is no disease. It is just because of pneumonia. Why the pneumonia is not responding to allopathic treatment? Despite of developed bacteriology, virology, they are not in a position to control bronchopneumonia, that is lower respiratory infection, and that is the ultimate cause of the death. If they go for integrated medicine, they definitely will prevent pneumonia in their ICUs. What is that integrated medicine is? Homeopathy or Ayurveda combined together and along with allopathy. I will tell you one of the integrated approach which happened during the corona period. See, the Siddha drug which Kachayam was given to everybody from Tamil Nadu Siddha Council, and that director has proved that that Kachayam is highly effective, and when they have given in allopathic hospitals, the patient started recovering, the death rate has come down. So he got 2 years back Padma Shri Award for his work because Kachaya Kudinir, you also know that word. So that Kachayam was alternatively given in an integrated approach where the bronchopneumonia and hypoxia, happy hypoxia has been disappeared in the patients of corona where they were treated with allopathy along with Siddha medicine. So such are the wonderful medicines where in integrated approach we can develop and we can see wonderful results. Then trachea and lung cancers. The other cause of the death nowadays is diabetes mellitus. Diabetic gangrene will leads to septicemia and below-knee amputation. That septicemia condition, if sepsis comes, the allopathic doctors will give up and the patient will die in intensive coronary unit. Then chronic obstructive pulmonary disorders, COPDs. Alzheimer's disease. This Alzheimer's disease is another disease where the brain will going on concussion and it will be atrophied and patient forgets everything. Patient forgets that he has taken water. So most of the Alzheimer's disorders will die of dehydration. And dehydration is another disease where the diarrheal conditions became very less in India, but even today the South African countries are suffering from dehydration. Tuberculosis is the secondary tuberculosis where it leads to bronchopneumonia. It is also killing. Cirrhosis. This is just because of modern world consuming more and more alcohol and making more and more patients of cirrhosis. Absolutely, cirrhosis management will be a tough job. So most of the patients, cirrhosis, complication with bronchopneumonia and dying. Apart from this, in India also, snake bites, accidents, genetic disorders, starvation and pandemics. Most of the people are dying because of snake bites. Despite of world developed so much, the agriculture in rural India and rural China, rural South Africa, snake bites, snake venom is not available. So most of the people will die with snake bites. And because of improve in the social standards of life, increasing in the city atmosphere, accidents are very common. Roads are not up to the mark, but there is technology has improved. Economy wise, everybody improved. So they purchase more vehicles, more accidents, more deaths, and genetic disorders. See, we could not cure some of the cases. At the same time, the genetic diseases are hunting the human beings. So most of the people are dying with genetic disorders. Despite of world economy developed, there are many poor people who are suffering with starvation. That's why the government of India has made right to have appetite and right to be provided with nutritious food. It is everybody's right. So government of India taken a condition, change the constitution that the starvation deaths must be controlled and pandemics such as coronavirus. Now, what are the genetic disorders that are causing genetic mutation? What is the between genes and chromosomes? Why these chromosomals? See, usually people will confuse. See, what are the chromosomes? The chromosome is a structure. There are 23 pairs of chromosomes. These chromosomes will have genetic mutation, genetic condition, that is deoxyribonucleic RNA and DNA. That DNA will give a mutation, gene or genes, which will change the instructions and making protein. These proteins will give us our forefather genetic characters. So these genes also will carry without changing the chromosomes. Now, most of the homeopathic drugs or medicines which have been done research, they are having a tendency to change DNA structures. That's why you will find in your clinical practice curing a malignant case, curing a bronchial asthma case, curing a case that is genetically affected, and it is childhood asthmas are highly curable. But usually all these asthmas are genetically affected disorders. So these disorders are being controlled by homeopathic medicines. That means the homeopathic medicine is having a power to affect the genes. Genes are being stored in chromosomes. This mutation can cause a protein not to work properly. So what happens in chromosomes? There will be a mutation, overlapping of the genes, sublapping of the genes. These gene structure will give the map of healthy human being. They will either have mutation double or sometimes the gene will mix. These genes are building blocks of hereditary and passed from parenthood to childhood. The shape of the body, the color of the body, the size of the body, the healthy human structure, and even the age of the body, how many days he has to survive, at which part of the which age he has to get which disease condition. These all are prefixed in genes. Suppose one has to get diabetes at the age of 50, he will get at the age of 50 the diabetes. Because the genetic mutation, genetic writing will be so much. Suppose in one of the families, people will live up to 90 years. So in those families, they live up to 90 years. These all are because of genetic mutations. The family malignancies, in some of the families, malignancy will come in families. These all are genetic mutations. They developed family malignancy conditions. So these are the genes that will affect. So there is a lot of difference between chromosomal effect and genetic effect. The homeopathic medicines are in a position to change the DNA. By that, what happens? The genetic disorders also will come down. The genetic disorders are classified by Hahnemann as double complex disorders. Most of the double complex disorders are not curable, but some of the double complex disorders are curable by homeopathy. That means a homeopathic doctor, without his knowledge, he is curing the genetic disorders. I will cryptically talk about homeopathy also. So what are the genetic disorders? Down syndrome. This is trisomy 21. The 21st pair of chromosome will be affected. I told you the genetic disorders and chromosomal disorders. The genetic disorders are entirely different. That is bronchial asthma and some of the diabetic mellitus. See, the diabetes, type 2 diabetes is curable with homeopathy and controlled with homeopathy, palliated by homeopathy. Whereas type 1 diabetes, which is a chromosomal defect, at a particular age, the pancreas will not function. There, the insulin is required. That insulin must be given, and there the homeopathy fails. So a DNA condition where the proliferation of DNA is present, there the homeopathic medicines will work out very well. Where the chromosomes defect is present, there homeopathy never works. So this condition was understood by Hahnemann. That's why he made the diseases into chronic diseases and double complex diseases. So some of the chromosomal disorders are Down syndrome, cystic fibrosis. Cystic fibrosis is the lung that chromosomes fiber the fibrotic lung, and heart conditions. See, first let me talk about the cystic fibrosis. Can damage many organs, including lungs, pancreas, liver, kidney, intestines, and mucus and clog in airways. What happens in cystic fibrosis? It is like what you call like a fungus. It will grow everywhere, and the fibrous tissue will come out of the lungs and it will spread. See, endometriosis in uterus. That is a curable condition in homeopathy. So such fibrotic diseases also curable in homeopathy, where homeopathy will enter into DNA mutation. So then Huntington's chorea, that means it is a nervous disorder. Usually this results in progressive movements, thinking congenitive and psychiatric symptoms. It usually starts in 30s and 40s. What happens here? The nervous system will develop abnormality. It is a chromosomal disorder. It is very difficult to treat, but we have to treat with physiotherapy, with speech therapy, with management of the symptoms. So some of the disease conditions, these are incurable. A homeopathic doctor must, whenever a case comes to his clinic, he has to understand whether the disease is curable or not. What is the diagnosis? What is the limitation of that particular system of medicine or the physician's limitation in that particular diagnosis? That's why the cure and curative, whether it is curable or not, what role I can do here as a homeopathic physician. What happens if he cures one case in homeopathy? It is a general practice to boast that he cures everything. See, one cancer case comes down, the other cancer case is a tough task. The previous experience never works in this chronic case because that particular remedy, that particular patient is entirely different. This particular patient is entirely different. They are with chromosomal defects, they are genetic disorders. In that particular condition, the mutation that took in genes has been changed, but in this particular patient, it may not be changeable. So a homeopathic doctor has to understand the limitation. He should not come into the jump. See, he cannot become a specialist of every disease condition. Nowadays, I am seeing many homeopathic doctors are having a cancer specialist, malignant specialist. That job is not possible in homeopathy. At the same time, we can address all the specialist disorders which are incurable, which are genetically modified, needs genetic modification, which are chromosomal abnormalities. We can attend the disease condition, but we cannot make it as a genetic or general improvement. This limitation every homeopathic doctor has to understand. So another is Duchenne's muscular dystrophy, pseudohypertrophic muscular dystrophy, pseudohypertrophic muscular atrophies. They are also chromosomal defects. So these disorders can't be treated. But here management is needed. When the hypertrophy of the muscles, usually thigh muscles, usually buttocks, they either grow or they atrophy. So we have to stop the atrophy of that particular muscle because of the nervous system being involved, or because of nervous system involved, the muscle will grow in such a way, only the other muscles will atrophy takes place, this particular muscle will grow. So how many days we can stop, we have to see. In such cases, we should not take that case that I will cure it. No, there we have to go for various pathological conditions, various nerve conduction tests, then we have to scientifically treat. So we have to know the limitation, what is curable. Then a group of disorders that cause red blood cells to become mishappen. This is sickle cell anemia. This is sickle cell anemia. Sickle cell anemia is a genetic disorder. It is clotting of red blood cells, and this can be a the chromosomal disease. This can't be cured. So we have to take the help of hematologists. We have to take help of the blood treatments, include medication, blood transfusion, and bone marrow transplantation also. Apart from that, a homeopathic treatment, an integrated approach to make the red blood cells not to get anemic rapidly, and the patient life expectancy should be increased. So such cases, when a homeopathic doctor maintains, he cannot expect from the previous case which we treated, the same success will come. The same success will not come in homeopathy, because these all are chromosomal defects and genetic disorders. The other condition, which is hemophilia. I have taken research on hemophilia. Hemophilia A and hemophilia B, both are incurable. But how to make a patient not to depend so much on factors, factor 9, factor 8, and factor 14. There the homeopathic treatment will come. So in such condition, we have to take such cases only for palliation. We have to know our limitation, whether we will cure the disease condition or not. Symptoms include many large, deep and bruises and intra-articular bleeding. So the clotting mechanism in the blood, the fibrinogen will fail, the vitamin K deficiency will come. So these all have to be understood before taking the case for treatment. We have to rethink, and we have to understand our limitation. Then thalassemia. Thalassemia is a blood disorder involving lower than normal amounts of the oxygen carrying the proteins. What happens in this? The blood cells will carry less. What is the blood cells that are carrying oxygen? Is red blood cells. So they will be very few, and that will carry very less oxygen in the protein form, so that always hemoglobin will be, always red blood cells will come down. For this also, stem cells, bone marrow transplantation is needed. So in such conditions, what a homeopathy can do? Can we stimulate the bone marrow? We have to think in a different way. The totality of the approach that we take in that cases will be entirely different when we apply our treatment to integrated approach. How can we help a hematologist? How can we help a pathologist who will transplant the bone marrow? How can we help a specialist in malignancies to make his condition better by treating simultaneously in an integrated approach, instead of thinking that how to cure this? So these are some of the disease conditions which are incurable. And fragile syndrome. This is a genetic condition causing intellectual disability. What happens? X syndrome. X chromosome will disappear. This is where he will become an idiot. You will find in Beretta curve, Calcaria curve. When we read the blood, when we read the drug picture, we will be very happy. But when we apply medicine, we will fail, because it is a chromosomal disorder. It is a genetic mutation will take place. Homeopathy will reach up to genetic condition. In which conditions? Such as bronchial asthmas, but not in chromosomal disorders. Therapy can be used to treat learning disabilities. Medication may be used to treat anxiety, because what happens in autism, he will develop more and more anxiety, more and more restlessness. We can decrease the restlessness, but we cannot cure that particular autism stage number 3 and 4. So we have to understand the limitations. Before understanding the limitation, what happens? Every homeopathic doctor, usually I will see the advertisements, specialistic treatment, specialistic availability of the treatment. They have to make a thorough investigations. They have to take such cases more and more, and they have to understand their limitation. And wherever the treatment that is possible and the probability of where we can explore homeopathy, we have to explore such treatments instead of thinking that we will cure the case. So these are some of the conditions. Why I am talking all these conditions is, Next, I will go for curative aspect of the drug. What are the drugs that are having curative aspects? Here, what happens in all these disease conditions, the research where we have to carry out the research. The modern research has gone to such an extent that they are not in a position to take up research in homeopathy. The research in homeopathy that is being taken up in at present day, particularly in India, there is no research anywhere in homeopathy other than India. The India is the best country, has developed modern research and maximum research in homeopathy. See, either Pakistan or Bangladesh or Mexico or Russia and rest of all the countries, they haven't developed the disease protocols and they never competed with allopathy, but they use homeopathy. Homeopathy is scientific because it is scientific, it is existing in between people. If it is not scientific, it could not have perished. But is it perishing? But the homeopathy research that is possible in India is confused now. The institutes have confused what they want, which research they want. They will carry clinical studies in a different places. See, I carried out a clinical studies on rheumatoid arthritis. But what we need in homeopathy is, the homeopathy is being criticized not because it is less effective. Nobody is saying, see, they are also studying the side effects of homeopathic medicines. When the side effects of homeopathic medicines are present, do we, without any effects, how its side effects will be produced? So there is efficacy. What is our fundamental, how the institutions run by the governments are confused. They do not know what research they actually need. They will take up one tie-up with one institute and they will carry out the research. But homeopathy needs the fundamental research, the presence of quantity of the drug in the potencies. Otherwise, we have to change our potency theory and presence of mechanism of the action of the drug, where the algorithms are present. See, in clinical practice, in clinical research, we have carried where the mechanism is going to take place. The algorithms, the in vitro studies, they have been made, but without knowing the what is the drug that is present. We have taken up the drugs pathology also. Single drug proving is not sufficient. So think that I have proved around 13 drugs, but 13 drugs proven is algorithm is not enough in a scientific world. So homeopathy has to take up animal provings. See, homeopathy is found to be very effective in veterinary science, in agriculture science. Veterinary science absolutely don't have any communicative languages to take the case record. But we will discuss that patient from one patient to other patient is different. So each patient needs separate case record. Mental symptoms are most important. So what are the mental symptoms? The previous session also I heard, they will discuss very thoroughly about the psychiatric part of the drug, medorinum and appetite part of the drug. So I would like to ask as a researcher, how many cases we have seen the total drug picture coming in our clinic? Has anybody has seen arsenic aggravation during night time? Are the arsenic head very hot? The body temperature, arsenic head is cold and the body temperature is very high. Are the burning symptoms of the phosphorus, sulfur? Have we got any case? The low appetite has any patient told? And we also should not dwell without proving on theories like, don't think otherwise, Herring's law of cure. How many cases we are taking and how many cases we cured according to Herring's law of cure? What is that is most important organ will be treated last and less important organ will be treated first. Which are the disease conditions that come under Herring's law of cure? Suppose allergic bronchitis and allergic dermatitis. How many cases of allergic bronchitis and allergic dermatitis are going hand in hand came to our clinic where we could prove the Herring's law of cure? Which is most important organ for which disease? Which disease will be affected when you are thinking of organs? You have to understand pathology. When you are understanding pathology, you have to understand physiology. When you are understanding physiology and pathology, one has to understand immunology. Altogether, if you bring into homeopathy, then the classic homeopathy doctor says, merely understanding the subject knowledge is not sufficient. Homeopathy is an individual case studies. When we do individual case studies, again less important organ to more important organ will come. So which is less important organ, which is more important organ, how symptoms will translate? These studies were not taken place in homeopathy despite the opportunities were present. Now the allopathy or the modern technology has reached so much that nobody is interested to take up any study in homeopathy. Despite the efficacy of homeopathy is so much present in integrated medical approach, you will receive various cases in your clinics. You are very good in a position to treat various cases homeopathically. When the case is telling the success stories, we are not in a position to find out or document your success into a research and document your how you are successful. What we need is, if we fail, why we fail. If we are successful, why we are unsuccessful. It is the duty of the scientist to provide extraordinary knowledge to the physician. Our institutes under the governments have failed to fulfill this research. They are so far they haven't, though veterinary science is very successful, till now we are not proved our drugs on animals. And the same thing in research on human beings. We are starting a drug proving. When a drug proving, how he will be given corona-19 virus? Which is the studies, which is the institute that is having a ethical committee that can be allowed to treat a coronavirus or to be proved in such a laboratory? So these all are some of the dark areas of homeopathy. I am telling this doesn't mean that homeopathy don't have efficacy. I want to tell you that we have to always, we have to self-estimation, self-assessment and introspection is needed. So before you go for anything, what is cure, what is curative, we have to study thoroughly. The next time I will come up with the drugs which are curative drugs. Suppose we are talking about the individuality. We have around 4,025 drugs so far. So these 4,025 drugs cannot cure 1 crore patients, no? 1 crore drugs are needed if the theory has to be followed. So we have to convince the modern science. We have to be on par with modern science, means we have to carry out the research. You people kindly guide the government that what is the research needed, not what is the research that is for show or that is somebody criticized. The fundamental research is the drug presence in the quantity of the drug present in that particular potency. See, we have carried out a drug research. The drug is effective in 6 potency, in 30 potency, in 200, and CM and LM potencies. All the curative rates are same. The LM potency rate has to increase the curative rate. No, it is not like that. All the potencies have given same type of efficacy. That means all the potencies are having medicine. Only one potency is sufficient to cure the disease conditions, that all other potencies will not work. There we have to change the drug. We have to find out the complementary of our drug and we have to cure. Such is the research outcome. So next time I will go for curative, drugs complementary action, drugs relationship, drugs relationship along with the how they came. Nobody knows. See, we will read the last pages of Boric Materia Medica. Bryonia and Rustox are inimical and complementaries. How this happened, what is the scientific study we have taken place, I will explain in my next class. There is 5 minutes left. Kindly, please.
Thank you, sir.
You can raise questions so that I can think that there is some response for my lecture.
Thank you very much, sir. Sir, please close the screen share.
Yes, sir.
Now, we are very much how I don't know. we are disappointed, or we are energized. Such questions, thousands of questions raised by doctor. So this is very much needed for to say how this is scientifically proved. Our homeopathic medicine is how a Herculean task for us in front of us. Each and every question she raised is a thousand heavier. We cannot even imagine what we should do. So now the Dr. Danesh want to ask something. Doctor, you ask.
Yes, Prakash Rao sir, it's really an excellent session. It is really a mind-blowing session from you once again. You really asked $100 million question here. How homeopathic aggravation affect the patient? Really, we are not doctors who are producing any iatrogenic diseases, but as far as the other system people are concerned, they are making iatrogenic diseases day by day and making things impossible for the patient to survive. We know that a lot of cases that are coming towards us are due to these iatrogenic problems because the patient believe that this doctor can do certain wonders. That's why they are going to the allopathic doctors and they are sticking on there, and they usually change the name of the brand of the medicine, and they give adding medicine again and again. As the patient say that, doctor, my pain is increasing and no relief, then they give steroids, and after using the steroid, we know that a lot of autoimmune diseases are happening in patients because of the over medication. And as far as homeopathy is concerned, there is nothing like that happen. As people will say that Dr. Hahnemann has told that there is a homeopathic aggravation, but if there is an aggravation, it will vanish within a short time. And if the aggravation does not mean that it will last for so many days or so many years, and the patient will go into a bedridden patient. No, never a homeopathic patient will go to a bedridden patient after taking homeopathic medicine. He will recover within 48 hours. That's what we used to see. And in between, if you are giving good advice and giving food, good quality of food and good life situation, definitely homeopathy can bring back the what we call as cure. And this is what you mentioned, cure and curative. Both are the two sides of a same coin. And once again, I congratulate you, sir, for your excellent session in this evening.
Thank you.
Thank you, Dr.
so much,
Danesh.
sir.
And
Danesh,
then,
sir.
okay. Now, Dr. Hariharan, sir, please unmute,
Oh,
sir, and
Hariharan sir.
unmute, sir. Unmute, sir. Hariharan, sir. Yeah.
Okay, good evening, sir.
Good evening, sir. Namaskaram, sir. Tell me, sir.
Namaskaram. It is highly commendable. Totally, I am agreeing with you. See, especially in certain areas, we must join with the allopathic doctors and we must do the research in certain areas. Of course, we have our own areas, but in certain particular cases, we must join with them and try to understand the inner mechanism, inner things, inner substance concerned with the patients. That is what I want to tell you. But again, our homeopaths have a disease. Homeopaths have a disease. That what is that always they are questioning them and they are saying allopathy is injurious. Allopathy is injurious. It is a suppressive mechanism. Always they are insulting them. That I am seeing so many that we became fanatic in such in certain homeopaths are fanatic. I am seeing that. So we must avoid that and join with them lovingly and we must research with them and find out actually what is curative and which is curing a patient. See, that is what I want to say, sir.
Yes,
Okay,
sir.
thank you very
Thank
much.
you.
Thank you very much, sir.
Sri Dr. Vishwanathan,
Yes, yeah, sir, I am not a doctor.
Okay.
No
I
problem,
am,
sir.
yeah, I am Vishwanathan from Ahmedabad.
Yes, sir.
Okay, sir, can you ask anything?
Pardon?
do you
Can
want
you
to
ask? You want to ask
Yeah,
anything?
yeah, I want to ask something. First of
Yeah.
all, I want to congratulate the doctor, Dr. Rao, for the excellent presentation and the knowledge and area which you had covered, and homeopathy, which is not very well known to everybody. He had opened up a very good area to know all these things. My question here is, sir, he had mentioned this pneumonia. It is again, especially the last stage, it is converting to pneumonia. Then when doctor had come up with some Ayurvedic syrup in Madras, when he applied it, it was most curative. And my question is, then after getting the doctor, that doctor also some Padma Shri award.
Yes, sir.
Why this integrated? We cannot integrate this treatment to the patients, which is already proven in these areas. This is my question.
Yes, sir. We can integrate, sir. Not only integration, sir. Homeopathy is having a benchmark in the sense all specialistic cases. See, leukoderma, one of the case, everybody might have experienced. You are senior doctors. At least one leukoderma case you might have treated. Actually, leukoderma, there is no treatment in allopathy. See, all genetic mutations. But one case will be curable by every homeopathic doctor in his lifetime. He may not treat all the leukoderma cases, but at least 1 to 2 cases definitely he treats. In the same fashion, for pneumonia also, there is a medicine in homeopathy, and that Kudinir Kasayam, that was found to be effective. It removed the bronchopneumonia and happy hypoxia in corona patients in Madras Medical College. The drug was given not by Siddha doctors, drug was prescribed by allopathic doctors in their wards. So they have made thorough study and they found that it was effective and it avoided many deaths just because of Kapala Kudinir Kachayam. And such wonderful remedies, even in homeopathy, they are present. We have to next time explore. I will tell you about where homeopathy can be explored. Migraines, lumbago, backache, sciatica, cervical column stenosis, spercalcanium, bursitis, tennis elbow, ulcers, piles, fistula in ano, urinary tract infection. These all are curable with homeopathy, apart from allergies. So a homeopathy doctor has to explore. So far, our institutes never came up with anything that is constant and to explain the new students in the college that you kindly treat these cases. In our syllabus, we don't have anything. Next time, I will discuss all these things. What are curable, where a college student, where a physician should go comfortably with a confidence that he can open a homeopathic clinic. And in his homeopathic clinic, what are the disease conditions he can explore very happily without studying anything. Those such type of research has to take place. That is not present in our. They are confused people nowadays. See, homeopathy, I told you, homeopathy is very effective on agriculture. Homeopathy came, agro homeopathy, veterinary homeopathy came. At the same time, our people, they think that mental symptoms are most important. Physical symptoms are, they are going on discussing, they are losing here the ground because they are confused in their research. If they
Thank
could
you,
have
sir.
done the proper research, they could have guided the physicians very well. So what happens, every physician comes out, people like Dr. Danesh, people like Dr. Hubert, they make their own material, their own experience. What to do, because they have to study, whatever they studied in the college is not up to the mark. So the college curriculum has to change. What to teach, what are the confidently homeopathic doctor can treat. They were not taught. See, how to relieve typhoid fever, with which medicine, what to do in typhoid fever. Suppose a diabetic patient with typhoid fever, what to do. diabetic hypertension with typhoid fever, what to do. These all next time I will tell you with the documentation. in
Sorry,
Tata.
sir. Now the time is
Yes,
for
sir.
to start our.
Yes, sir.
But it is a great thing. Only I say that God's only say the answer.
Research, see.
So I invite Dr.
Yes, sir.
Danish to say, Dr. Vishwanath sir,
I
please
want to
say
add,
vote of thanks to Dr. Prakash Rao sir.
yes, doctor. Yes, I
Uh,
want to add just one point to Mr. Vishwanath Perumal's question, because when
Wonderful question, sir.
yeah,
Thank you.
Dr. Anpamani Ramdas was the health minister of India.
Yes.
He tried to implement the integrated system, including all systems in one hospital, under one umbrella. But unfortunately, doctors from India, Kerala, particularly IMA people, rejected the idea. And that's, but even though that happens in Kerala, in other part of the countries, it is running in successful way. So that's the answer to the question. Anyway, we are trying to bring all the Modi government was trying to bring back the same to this area, all India level. So we can hope that in the future it will happen. Anyway, we on behalf of International Forum for Promoting Homeopathy, as well as on my behalf, thanking you, Dr. Prakash.
Thank you, sir. Namaskaram, sir. Thank you very much, sir.
Presentation in this evening. Hope we can have the third edition of the same in the coming month. Thank you.
Yes, sir. Yes, sir. Thank you, sir. Namaskaram.
Thank you all, Dr. Prakash Rao sir. And now we are passing to our next session, our Malayalam
Malayalam.
session. Very much thankful to all of you attended and raised questions. Thank you all. Now I invite Dr. Mariama John to do our next session, Malayalam session. I invite.
നന്ദി ഡോക്ടറെ.